Hi there, this is Dr. Paul with Family Hearing Care in Traverse City. Today I wanted to spend a minute showing you how to insert a hearing aid. There are different styles of hearing aids, and sometimes it can be a challenge. Getting them in properly will prevent loss, and certainly something that you should master within a couple of days, hopefully. Let's start with this behind the ear style, and I've actually have a left and a right, and when you're inserting a hearing aid, you should use the right hand for the right ear, left hand for the left ear. Even if you're predominantly one-sided, it's very difficult to insert the left hearing aid with the right hand, and I would discourage that. So, this being a right hearing aid, and how do I know? It has the red marker on it. Left hearing aids have a blue marker or a blue dot of sort. Any way you get it in is the right way. I'm going to show you two ways that I do, but if you find your hands work best in a certain way, use whatever works. I like to hold the hearing aid with my first finger and thumb of the hand, right hand for the right hearing aid, where the wire goes into the hearing aid. I'm now going to cock my elbow and bring this to the top of my ear and leave it sitting at the very top. I'm going to let my finger and thumb run down the wire to what I call the elbow, that curve right there. I'm going to grab it, stick it in my ear, and then I'm going to take my first finger and get behind the wire and just push gently with a twist towards my nose. I want that wire to lay snug against the skin of my ear right through here. I don't want any kind of a gap. If there's a gap, something like this, it's not in all the way. Take your finger, get behind the wire, push in, and then you have this little strap here. That strap is just to securely hold it in the ear. I'm going to curl that back and just lay it inside what we call the concha bowl, right here in that ear. All right? So again, when it's in properly, that wire should be close to the skin with no kind of gap. On the left one, I don't have a strap. The process is the same. You're going to hold it with your first finger and thumb where the wire goes into the hearing aid. Cock the elbow. Put it at the top of the ear. It doesn't go way back here. Leave it at the top. Let your finger and thumb slide down. Grab the elbow, that I call it. Push into the ear canal towards your nose. The ear canal doesn't go straight across. It goes forward. Get your fingernail behind the wire. Push in with a little bit of a twist. And you again should feel that wire nice and tight to the skin. That will be secure and it won't fall out. If you have it out here where there's a big gap, not only are you not going to hear well, but you may very well lose the hearing aid. So again, make sure that you get it inserted all the way. You might want to look in the mirror just to make sure there's no gap there. To take the hearing aid out, you just grab the middle of the wire with your finger and thumb and pull. And again, same thing on that right side. When you're using a custom aid or an in-the-ear hearing aid, this is what we call a full shell. It fills in the whole ear. This is a half shell. This is a left hearing aid, this is a right hearing aid. With these, what you want to be careful with is how you orient the hearing aid in your finger hold, as well as how you insert it. If you are going to cock your elbow, you're going to roll the hearing aid over on itself 90 degrees. And what I would prefer is holding the hearing aid with a finger and thumb and sliding it on a horizontal scale. That way the hearing aid is staying in the same plane. It's not twisting on itself. If you pull it, or if you roll it over, you'll try to be putting it in sideways, and it's not going to stay in there and it's not going to be comfortable. If you do it on a horizontal plane, you take the hearing aid, keep it again on this horizontal plane. I'm coming to the back of my ear, coming forward into the ear canal, and just gently putting it in. And it slides right in because it's been custom made to my canal. Taking this hearing aid out, you just take your thumbnail, get rid of your fingers, make a fist, take your thumb, get underneath the bottom of it and lift it up, and it will crawl kind of right into your hand and it comes out very easily. The full shell hearing aid, same process. Again, you're taking this on a horizontal plane and I'm just making my arm stay level. Bring it to the back of the ear, come forward into the ear canal. I sometimes stretch the ear out and just tamp it in, and it should feel secure. If this isn't in all the way, the top sometimes is hanging out here, and again, could cause a little sore spot, could lose the hearing aid. You want to make sure that that's in, and you can stretch the ear out in all directions. The same process for taking it out. Get rid of your fingers, take your thumbnail on the bottom, and lift straight up, and it comes right into your hand. If you're still having problems and it becomes frustrating, follow this rule. 3 strikes, you're out. Typically what I would tell you to do, if it doesn't go in within 30 seconds, on either the behind the ear or the in the ears, if you're not getting it in within 30 seconds, it probably has gotten twisted out of position. Start over, bring it back out in front of you, hold it like you should, and do it again. If you don't get it in within 3 tries, put it down and come back to it later. Typically you'll start to develop a little bit of a tremor, or you'll get frustrated to a point where it's not worth it. Give yourself a break. Again, if you're struggling, give us a call. Thanks. This is Dr. Paul with Family Hearing Care.